Hello, I'm Jonathan Tvtian, and I wanted to raise public awareness about a certain defect known as atrioventricular canal defect. I'll be discussing the course of the disease, its complications, and treatments. This defect affects many newborn babies. Now, I want to talk about the normal function of the heart first. There are four chambers. First, blood flows into the right atrium here. Then it goes down a valve into the right ventricle. The right ventricle pumps the deoxygenated blood around into the lungs. Then it comes back down into the left atrium, goes down another valve into the left ventricle, which is the final chamber of the heart, which then pumps the blood into the aorta, which goes to the rest of the body. Now, in the abnormal function, the wall that separates the four chambers is actually absent. So deoxygenated blood from the right atrium mixes with the left atrium, and this causes a lot of problems. It can cause deoxygenated blood to go into the body, and it can cause the heart to enlarge and overswell, having to accompany all of this fluid. That's the partial version. In the complete version of the defect, the walls are totally absent, and both blood from the atrium and blood from the ventricles actually mix together as well, making it even worse for the newborn baby. Now, this can arise from a variety of complications. First would be pulmonary hypertension. This is because the increased blood pressure within the heart actually transfers along the pulmonary circulation into the lungs. This enlarges the vessels and increases the blood pressure, making the lungs have to overwork as well. Additionally, we also have heart failure because the heart is barely functioning on its own after the baby is delivered, and the increased fluid can actually cause it to have heart failure. The heart also has to enlarge to accommodate the fluid, and additionally, because of abnormal valves, as you can see here, bacteria can actually form along the valves and cause possibly a respiratory tract infection. Here we have additional info. Symptoms include swelling, fatigue, edema, also poor nutrition, heart flutters, and increased heart rate. There's a variety of risk factors. These include unhealthy lifestyles such as drinking, smoking, and use of illicit substances. There's also a variety of genetic risk factors such as Down syndrome, and having had the defect yourself, you do have a chance of passing it on to your offspring. There's also a variety of treatments to treat this disease. The first would be surgery accompanied with infection control, medical drugs, and a nutrition plan for the child. And after this surgery, prognosis looks very well for the child. So the first thing always is to just always look after your child and see if there's anything wrong with them. Bring them into the doctor and make sure that they get taken care of.